Hi there. This video is about how our medication monitoring checks protocol works every time any kind of high-risk medication is issued. It can be launched manually in the prescribing overview template or in the view if you've got it on your clinical tree. You can launch it manually to do some checks. Where are we? Med monitoring checks. There's a kind of prescriber's version and non-prescriber's version that works slightly differently, but broadly doing the same thing. Most of the time, the checks will just run in the background and basically be checking, say, methotrexate, which I'm about to try and issue. Are the bloods up to date? And if they are, it won't pop anything up. It will just document that in the background, which gives a lovely audit trail and shows the things that have been checked. But this is a test patient, my cat, who never comes for his bloods. So if I issue this, it's going to flag up that his methotrexate monitoring is overdue. It's also flagged that the DOAC is overdue because it's not just looking at what I've issued right now, but what else I might be about to issue. And as an admin person, perhaps issuing this medication, it's asking me to call the patient to book. Now, at this point in the middle of a busy day, it's probably very tempting to click unable to call. But basically, it's really critical that this patient has this blood test. If they were already booked in, or the system thought they might be, then it would flag that and kind of do a bit of a check. Is this booked or not? But you really do want to stop and try and get the patient booked in at this point. Because if not, the possibility is that they have to be reduced from monthly prescriptions down to 2 weekly. They should have been invited already if all the kind of normal invites are happening in the background from the recall overview, but there's a chance that's been missed or they've not realised or whatever it might be. So what we recommend doing is call to book. That will then take you to this screen, excuse me, where it's working out what needs booking. You click book, you find the right free slot search, and so on and so forth. And hopefully most of the time you can book the patient in. You probably don't want to be waiting a long time for that appointment because they're already overdue. So it may well be that you want to take some embargoed slots or that you need to book things soon if there's nothing available soon. And in which case, that's fine. The protocol will document that and you can carry on going forwards. But if, for example, for some reason you can't get hold of them or the patient declines or whatever it might be, so let's say has an appointment booked, let's say no, then we need to think about what we're doing next. So has the medication been requested for issue? Yes, it has. So you've then got two options, though this can be changed, which I'll explain in a minute. So you've either got action now or prescriber to action. So in a minute, it's going to advise me to reduce them down to 2 weekly. Now, if I'm not very familiar with prescriptions and not highly trained, or if your practice has said, no, we do not want sort of prescription clerks or receptionists doing this, we can configure this so that it only gives the option for prescriber to action, rather than asking me like it is here, am I doing it or is someone else going to do it? To try and demonstrate, I'll show you what it would do if I'm going to action it myself. So action now. So if it's been issued, which the methotrexate has, I need to undo the issue and then reissue it at 2 week script duration. I'm going to have a go at doing this. I don't normally do scripts, which will probably just demonstrate that it's not the most straightforward. It's also generated this message to let the patient know. We obviously want to make them be aware that they've had their medication reduced to fortnightly. That may not go down very well, but it's really important to keep patients safe. And the way we've always looked at it is that we would far rather have a complaint from a patient saying, you've reduced my medication down to 2 weekly, than a complaint from a patient or a family where someone's come to harm because we've not monitored their medication. I can also tell you firsthand from experience, CQC don't want to just see that you're inviting these patients. They want to see that you're taking steps if they're not responding. So let's click send, and then we need to do what we've said. So we need to undo the issue. So right click and undo, or I guess that button there would do it. And this is where it would then get tricky, and I probably won't know what to do myself, but let's have a quick go. So number 4 tablets, well, I can divide 4 by 2 fairly easily. And I guess the issue duration is 14 days. And let's do that. And then I would also do the same with the apixaban, because that was the other thing that was flagged as needing to be reduced. The metformin, and this one is fine to issue as normal. If we go in Tab Journal, you'll be able to see the kinds of things that the system's documented. Here we are. So it's the fact that it's overdue. I tried to book the monitoring appointment, and some scripts have been reduced to fortnightly. There are lots of codes. These are important because the system is going to use this lot to work out what to do next time. So say the patient then does attend, they have the bloods, and then next time they request them, the medication, because of these codes, the system can then say, great, you can now put it back to monthly and follow a similar sort of process. If as a practice you're getting this pop up and it's giving you the options like it just did for me, and you want it to always direct to prescriber, we can do that. Let us know. Conversely, we can also take away the option to always direct to prescriber and just direct staff to do it. I think it varies a lot in practices who does this kind of work and how trained they are. It may also be something where at first you want it to direct to prescribers to get a sense of how it's working. When it does that, it will do similar things, but instead it will generate a task, and the task will explain what's going on and give you instructions if you're the prescriber. And for admin staff, it will basically just say, do not issue, cancel the issue, this needs review. We hope that helps. It takes a bit getting used to, but they are really kind of slow, step-by-step instructions. If you read them and get used to them, you should find they work fine. If you're not getting these pop-ups at all and you're not seeing these kind of entries in the background, it probably means it's not enabled at all, and you just need to drop us an email and we can turn this on for you. But you probably want to make sure people have watched this video and have some sense of what's happening before you do that. As ever, any questions, just give us a shout. Thanks.